Hi everyone. Hey everyone, it's Dr. Chook from the Toronto Concussion Clinic, and today I want to show you an exercise that we teach some of our patients when they're starting to retrain their balance. It involves some mindfulness and becoming familiar with the way you would have experienced the ground the first time you ever experienced the ground. So, can you imagine what that would feel like? We want you to try. So, if you look at my feet, this is the base of support. And this is my center of gravity, somewhere around the navel area. And we want you to explore the relationship between the center of gravity and the base of support over here. And so we get patients to, one, learn to feel the effect of their breath on their center of gravity. And oftentimes you'll find that if you breathe with your diaphragm like we try to get you guys to do, it kind of pulls your center of gravity forward a bit, and you feel the influence of your breath on your balance and your stability. Then we get people to kind of test the limits of their boundary, their base of support. So we can go this way, forward. We can go back from the ankles, right? Go side from one, go the other side. And I'm using the ankles there. And then people can use their knees to go forward, not so much going backwards. Knees can go this way, this way. Then a lot of people don't really use this strategy too much, but it's probably one of the most powerful strategies to control your balance, and that's using your hips. So that's kind of moving your hips out, your hips like that. A lot of people also don't intentionally do this, but they use their pelvis too, so they kind of angle their pelvis like that, and you angle your pelvis like that. And some people kind of bring their shoulder blades like that, and you can bring your neck like that. So how upright you are depends on how you use all those different joints and parts of your body. And so we try to get people to see the difference that they feel when they kind of play around with all those different configurations. And where do they feel the most stable? And we want you guys to do that. As you practice going to your base of support and using these different strategies, you'll probably come to see that, the hip hinge strategy is the most powerful. However, the other ones obviously have a role. Like sometimes, say you're standing on something and something kind of gets swept up from underneath you, then you obviously want to take a step, right? But there's just the ones to manipulate your center of gravity that are most powerful are the movements that are closest to the center of gravity. So think of judo. When people want to go and flip someone, you have to get in really close to the center of gravity and flip, kind of like that. So we're doing the same thing here. Once people learn to do that, then we get them to explore, how far they can veer to the left and right and all around, become familiar with that and the effect of their breath. And then you can also do this in sitting. You can use other props, like you can use a Dynadisc, or you can use foam or stability ball, that kind of stuff. And if you want to make it more complicated, you can stand on, a wobbly 2x4 or a Basu ball or something like that. And you can bring your stance closer together, like tandem stance, and do the exact same thing. You can feel the limits of your base of support and how your center of gravity lines up with all that. You can also do cognitive tasks like count backwards by 7 while you're doing those to see the influence of cognition on balance. You can also do visual tasks like have someone kind of trip you up with like strobe lens glasses, or spinning a striped umbrella, or having disco lights around to kind of trip you up and see the influence of that. And I think I had one more thing I can't remember I wanted to kind of mention to you guys is, oh yeah, and you can also look at the influence of neck turns changing up, because we automatically kind of, if you do this, you'll see that you automatically kind of change the configuration of your muscles, like they automatically kick in without you even kind of consciously telling them to do so. And so you can do the same thing and become aware of how those neck turns change the relationship between the center of gravity and the base of support. So I want you guys to take your time and really explore that, and explore all those different configurations that I was talking about of how you hold your body, and recognize the relationship between the center of gravity and the base of support. And next time we shoot a video, we're going to show you some, I already kind of gave you a hint, but we're going to show you some effective ways to manipulate your center of gravity relative to your base of support. So I hope that was helpful, and stay tuned for our next video where we help you on your road to recovery.